We're going to turn our attention once again to the broader international picture and the hunt for a vaccine, a hunt for cures, treatment lines which are now opening up. Joining us, Dr. Robert Gallo, co-founder of the Global Virus Network. We're also joined by Nischay Mishra, Assistant Professor of Epidemiology at Columbia University. I'd like to thank both of you very much for joining us. Dr. Gallo, let me come to you first. Are you hopeful of Oxford University making progress with that vaccine upon which we all hope, have placed so much hope? Do you believe that that might work?
I must tell you that I don't know enough about it. I have not read any details about it, so I cannot comment. Of course, I'm hopeful. If they say from Oxford, the group, that they have something ready to start to try, let's hope for them with them. That's
what
all
about
I can say at
the
this
efforts?
Another week, I'd be able to tell
Dr.
you.
Gallo, I understand. What about the efforts being made in Germany? Do you believe there's something there which makes you optimistic?
It's too early to say optimistic. If you're talking about a preventive vaccine, look, you're talking about candidates. People give dates, like we saw on the news from the United States, on those nightly news. There were debates about whether it's 5 months or 10 months or 12 months. You know, this is not accurate. All you can say is you'll have a candidate in X or Y number of months. But when you have a vaccine, you have a vaccine. You have proof that it works and that it's safe. Until then, you know, what can you say? You can say, I have a candidate, and let's see what happens. I mean, people have good ideas, and the quality of science in both places is very high. So we're hopeful. Let's be hopeful. But I cannot say yet that, and I haven't seen enough about them to be able to make any personal statement.
Okay. Dr. Mishra, one of the big concerns being expressed is COVID-19 mutating. So even if we are able to find a vaccine, and that, as Dr. Gallo points out, could be several months down the road and then some, isn't that the real fear, that the virus could have mutated to a form where what we are working on now may not necessarily have an impact?
Yes. In fact, like if you look at the coronaviruses, they do not mutate that much once they make the home in the human population. So far, I guess like around 1,000 sequences has been available. They are like just point mutation. They are not changing the structure of protein that much. And like Dr. Gallo said, there are multiple organizations, multiple groups working on different components. They all have a vaccine candidate. Some are trying the whole virus, attenuated virus, dead virus, or some are trying a specific protein or protein site. So when the vaccine will start coming in 16, 18 months or 14 months, like he said, we don't know. It's all a speculation. There's a component that might work in after down the line, and when they can produce it in the commercial purpose. So we don't know about it, but certainly there will be more than one candidate, and I am very certain about it. Not every vaccine candidate will fail at that moment. And like I said, coronaviruses are not like flu. They then that mutate that often, and that resort that often, where we need a like new vaccine every year. So I think when the vaccine, first or second vaccine product will be there, the whole population, it will minimize to maybe 80-90% right away. And of course, there has to be modification, annual strain and sequencing for the new strain to look at the target, what they are choosing for the vaccine. Is that modifying, or is it affecting the whole process, the whole efficacy of vaccine?
Sure.
So we need to look into that.
Right.
Yeah.
And so, Dr. Gallo, one final question to you. Remdesivir, a lot of people felt that, you know, that was definitely a line of treatment which would work immediately. But then on the basis of what we've seen, and on the basis of discovering that the World Health Organization had put out a document which suggested that in fact it wasn't working, they pulled that document down. Do you believe that that may not necessarily be a line of treatment at all?
I was surprised by the reports from the Chicago hospitals that it was somewhat effective, and they were positive in their reports. I was surprised. I did not expect it to be very useful. It's an antiviral drug, yeah, so to speak. It targets the polymerase, the enzyme that copies the RNA, so one would be a little hopeful, but it wasn't directed for the purpose of this particular virus, and I don't think it was so potent, and I wasn't expecting very much from it. Right now, I think it's, like this. So I'm not optimistic that that's the way forward. Let's put it that way.
And Dr. Gallo, again, just one final last question, because there are so many things to ask about COVID. The BCG vaccine that is being looked at over here in India, it's essentially a booster to immunity. What are your thoughts on that?
I think it's a very good idea, and I favor it. And then we're doing something parallel. We hope. Let me make sure. When you say you know something, you're close to 100%. I don't know. But I hope and I think the oral polio vaccine will be better. It will be safe. It'll be cheap. And there's plenty of it available at this point in time. Whereas BCG, there's a problem of the supply for other purposes. That's one. And number two, this is going to be even more promoting the innate, the basic immune response, not the real specific immune response, but what we call the immediate emergency response. And I think it could make a very significant difference in the epidemic properly used. But I favor the oral polio vaccine coming back for the very same purpose that they're using BCG. But I think better, I think cheaper, I think easier, and I think there's more of it. That's why we're promoting it.
Right. Dr. Gallo and Dr. Mishra, thank you both very much for joining us.